So, hello and welcome. We're going to talk today about a technique that is super popular and one of my favorites. And before we begin, I'll just say that I'm Mary Lee LaBay, and I'm here today with Graham Robinson, one of my graduates and a good friend now. And we're going to talk about a technique that he came up with that he's interested in. So, Graham, tell us a little bit about you and what are we going to talk about today?
Hi, Mary Lee. Well, as you say, this is a technique that I obviously studied with you, but I've used very successfully with clients. And we're talking about parts therapy. Now, there's lots of discussion online, and there are wonderful people who talk about, parts therapy and family therapy. But your process was a little bit different. And so I just wanted to talk about that so that people understood, I guess, that there are different ways of hypnotherapy can work for them, because I think if people haven't experienced hypnotherapy, and I've had a client that has said to me at the end, "Oh, this was amazing, but I came to it thinking, oh, I don't know what this would do for me. I don't understand." So, but there are also strong methods of healing within hypnotherapy. It's not just about going into a trance and having a nice meditation and feeling good. That can happen. Um, but yeah, so parts therapy, you, if you would like maybe to explain to me what parts therapy is and how you see it works best.
Yeah. Well, just to elaborate on something you said there, the hypnotherapy part of the treatment or the therapeutic approach that we have, the hypnotherapy in my mind, the way that I envision it is that the hypnosis part, we go into trance and we come out of trance. And that's the hypnotic part. And it gets us into a frame of mind where we're focused, we're relaxed, we're connected to our higher self, a broader consciousness that holds memories and wisdom. And then within that, we can apply these healing techniques. And so the techniques might come from psychology, NLP, which is neuro-linguistic programming. It may come from just a wide shamanism, a wide range of sources. But then we can do the healing. We can affect that during, while the person is in what I call the hypnotic envelope. And so parts therapy is one of those just amazing tools that we use. And whenever a client comes to us that has inner contradictions, inner conflict, they're facing a decision that they can't quite figure out. They have, and I want to say that we all face this all the time, right? Sometimes more severely and sometimes on, just kind of on a daily, daily basis where, if you ever say, well, a part of me wants to do this, but a part of me says I should do that, that's another reason to use parts therapy because that's exactly what you're talking about.
Mm,
You
mm,
have these different, it's like, oh, I really want to buy that new car. And another part of me is saying, your finances would be really nicked if you did that right now. You need to be more practical, right? And so it kind of finding a balance or finding the motivation between each of those sides and figuring out how to satisfy that and bring it together so that you are in integrity and you are unified internally so that you're making the right step forward and not arguing with yourself.
mm,
Should I eat that chocolate cake or not? Should I, buy the car? That's one. Should I marry this guy or not? Or should I get a divorce or not? Or should I have a baby or should I go to school? we're faced with decisions all the time. So it's a fantastic tool to have.
It's also interesting, of course, it can be used, and like you mentioned, all of those things. But also, if you have a sort of a long-held trauma, even fears or anxiety, you can bring them out and discuss them. What I always find amazing with it is that the client will actually you talk to the client and they have on we separate them out on two different hands to talk to each other. The client always is able to talk as the client and as one part and as the other, and they always seem amazed afterwards that they were able to do that. It's
Yeah.
fascinating, isn't it?
It's one of the proofs that they're actually in hypnosis. If you can, if your imagination can allow you to fully be in one side of the argument and fully in the other, and then have kind of an overview of both of them, that's definitely a trance state, right? Oh, it's just really fun and very productive tool.
So what would you say is the most beneficial thing about parts therapy? Um,
Well, I
when
would
you're
say
using
the
it?
takeaway that a client is going to have is coming to a conclusion, making a decision. And so, especially for people who struggle with decisions, this is just, anybody in the world could have this tool and use it on themselves in a journaling program or project, or, have it applied to them in therapy. It's probably most beneficial to do it in therapy because, if you're with a qualified therapist, of course, um, because they will hold that space and take you a little farther into these two sides than, you might just say, well, I would look good in a red Lamborghini, and, but then it would take you farther and farther down that path, so that you'd have more realizations, more knowledge, more understanding of why that's important, and then go to the other side and do the same thing, so that that therapist would be supporting both sides in a very neutral way. But the takeaway, to answer your question, is really to make that decision and feel good about it. That, when done properly, the person actually has a shift inside of them.
Mm.
There's usually a fairly tangible um, readjustment, like they've changed their perspective on the situation. They've learned something. They're standing differently in reality in regard to that particular topic.
Yes, and I guess that's one of the points. It's bringing it together to come to a decision. You mentioned that people go through this all the time, and we do. We have all these decisions, and I'm a procrastinator, so I struggle quite a bit. But I remember when I met my wife to be initially, she was also seeing, well, not seeing, but there was somebody else there too. And she wrote down a list of the benefits of me and the benefits of the other guy. And she
Yeah.
read them out to me. And I thought then it was quite odd. But really, it's just a simplistic version of parts therapy, really, at getting everything out, isn't it?
Yeah.
I still didn't, I still thought it was quite odd though. But have you ever had a client where parts therapy hasn't worked, where you've had to try something else because it's just not coming off?
Not really. I did have a client that didn't like parts therapy. We did it successfully. That wasn't a problem. But in a later session, he said, now I don't like that thing that you do when I'm talking to the different hands. I don't want to do that again. So I had to skirt around that and find other ways to help him. Which
Yeah.
it worked out fine because there's a lot of different approaches to any problem. But no, what is really interesting, if the person is being very, very honest and they're in a nice trance and they're receiving this wisdom, and you're being very patient with it and, going into it really nicely. Uh, I've been amazed that the client always picks the path of their highest good. Maybe they come and they're trying to give up smoking. I've never had a client that where they agree that, I'm going to just keep smoking 2 packs of
Mm.
cigarettes. They always agree either completely, I'm going to have this change of behavior, or I'm going to go in this direction, or they come together closer. Like in the case of smoking, maybe in that session, they're not ready to say, okay, I'm never going to have a cigarette again, but they may go from a pack down to 2 cigarettes a day. And so we're just getting closer, and then we'll do more therapy, and then we'll get closer until that decision can be made. But I've never had it go where they made the choice that was bad, destructive, sabotaging, evil. None of that.
It's interesting, of course, with your client that didn't like parts therapy. You could have done parts therapy on why they didn't like parts
Right.
therapy. That may have upset them a
Now, the
bit.
part of you that doesn't like arts therapy and the other part that knows it would really be good for you.
Um, in some instances, I've seen people utilize multiple parts, even though they're working on one part. They've got other parts in the room, or they set them up like around a table or something like that. You prefer to work just the one part. What do you see the benefits of just having that one part to work with?
I think the clarity is one thing. And so when they set it up where it's like a boardroom table or something, and there's the independent part of you and the emotional part and the logical part and all this stuff. I think it's confusing, and you have to keep listening to all these different people, and that might be why they're in contradiction to begin with, right? In conflict. So, what I like to do is take the issue and its polarity and just work with that. Because let's say they I'm trying to think. Well, I worked with somebody yesterday where the issue was depression and procrastination. So let's use procrastination. So the part that wants to put things off till later, and the other part that says let's just get it done and enjoy our time afterwards, right? Um, so we're just working with that polarity. So if we go into the part that's procrastinating, yeah, there'll be the emotional part. There'll be all these other factors in there. And then you go to the other side, there'll be all those other factors. But instead of giving them each a voice, they can talk from that perspective. They're all coming together through the lens of this particular activity rather than, you know, somebody, saying, well, I'm the one that wants to go to the university, and I'm the one that wants to get married, and I'm the one that is the father figure or whatever. It's like, it's just too much. So it's just very concise, very effective, very clear, and actually pretty quick. You can do parts therapy in 10 minutes and
Mm.
get to a really good conclusion. Now, in my therapy, in the way I'm doing it, you'd have some time going into trance, you could do parts therapy. But then when things are sorted out and they say, yeah, I'm going to go in this one direction, then usually there's some other therapeutic techniques we'd want to use to support that, because now they're going to be orienting themselves differently in the world, right? And so there could be some bumps in the road, and maybe they need to have self-confidence bolstered, or courage, or whatever we need to work on. There'd be other factors that we would work on then.
Is there areas that you wouldn't use parts therapy? You mentioned your client with depression. Would you use something else for that? You wouldn't prefer parts therapy for that?
Um, so she has severe, um, I guess they used to call it bipolar, but she goes into depression for months and then she's kind of hyper for some months and she's on medication and sees other therapists. And so the work that we do address that from the perspective of what I can do, you know, from the hypnotic perspective. Um, I use I use parts therapy on that. Yeah.
Mm.
There's very little that you wouldn't use parts therapy, but if the person comes to me and says, I want to do a past life, I wouldn't
Yeah.
do parts therapy unless they are resistant, right? So they want to do a past life, but they get in there and, they're a complete blank and they're having trouble connecting with the past life. I might use parts therapy between the part that wants to do the past life and the part that's resisting, right? So that might be usually if it comes to that and I have to do something like that, then after that it's completely smooth because all the fears and the whatever is in that resisting side have dissipated and they've decided, yes, I'm going to move forward. And then, it's easy. We just move forward. Um, I'm trying to think of what else we would not do with parts therapy. Um, I don't know. You can fold, I don't always do parts
Mm.
therapy, but you can fold it into almost any type of.
Yeah. As you say, it's interesting the decision that you or having a client who may not go into past lives or your reverse metaphor, they struggle with that. You can then use parts therapy to open that door for them. So
Yeah.
it really, I mean, it is a very powerful, as many hypnotherapy techniques are, but it's a very powerful thing. And as most people, and there's other people who do parts therapy in different ways, of course. Now, next time we chat, we're going to change direction a little and we're going to talk about you. We're going to find about your career, where it started, and what it was like because you've been doing this work for over 30 years. So obviously the feeling 30 years ago as compared to today must have been very different. So it'll be fascinating to find out what the differences are in your eyes now and where you began and how you found it and what attracted you to the work you do. So that's what we'll explore next week.
Okay. All
Next
right.
time.
We will delve into that. Awesome. Well, thank you very much for today. And thank you to the audience for listening and being here. And we'll see you next time.
I'm looking forward to it. Bye bye.